Doctors will, universally tell you that exercise is just the ultimate cure for chronic stress. Like it's the bedrock of modern medical advice.
Oh, absolutely. It's prescribed for almost everything.
Right. But what happens when you have an autoimmune condition where the simple friction of a yoga pant or, I don't know, the pressure of a bike seat actively causes your skin to tear?
Yeah, that's a brutal reality for a lot of people.
It really is. So today's deep dive is tackling this highly specific, but just incredibly agonizing dilemma for anyone dealing with lichen sclerosus or LS.
Yeah.
Like, can exercise actually make the condition worse?
Which is such a profound paradox for patients.
Exactly. And if you're trying to navigate that tension needing to move for your mental health, but the physical movement is causing intense pain, how do you actually manage it?
Because on one hand, you're being told by the medical establishment to move your body to manage the stress that triggers autoimmune conditions in the first place.
Yeah.
But then the mechanical reality of moving just feels like it's aggressively fueling the disease.
So to figure out how to break that cycle, we pulled together this massive stack of sources for you. We're looking at the clinical guidelines from the NHS, the Women's Health Clinic, and Oxford University hospitals.
Which are great, but, clinical data really only gives you the mechanics of it.
Exactly. So we paired those medical texts with these really powerful lived experience accounts from patient platforms. We looked at the Lichen Sclerosus Guide, Mayo Clinic Connect, and this deeply insightful blog called The Lost Labia Chronicles.
Yeah, those patient communities are so vital. The clinical literature explains the pathology, sure, but it's the patients who actually provide the survival strategies.
Right.
Like, the medical guys rarely tell you what kind of underwear to buy or how to sit on a stationary bike.
Okay, let's unpack this, because before we even get into the physical modifications, we really have to look at the psychological trap that happens right after an LS diagnosis.
The instinct to just freeze.
Yes. There's this deeply ingrained instinct that pushes patients to just completely stop moving. And you see this vividly illustrated in the Lost Labia Chronicle.
Oh, Jacqueline's story, yeah.
Right. The author, Jacqueline, was this super dedicated weightlifter. She was in the gym like 5 to 6 days a week, and she explicitly states this wasn't about aesthetics for her. It was her primary coping mechanism for just the stress of daily life.
The gym was her anchor.
Exactly. But the undiagnosed symptoms of her LS began to turn that anchor into a literal source of trauma. She had these undiagnosed fissures, microscopic tears on her vulva.
Which are incredibly painful.
So painful. She describes getting on the seated adductor machine at her gym. You know, the machine where you're seated and you've got those padded levers against the insides of your knees?
Right, and you're squeezing your legs together against the resistance.
Yeah, and pushing them apart. It became absolutely agonizing for her. Every single repetition was just unknowingly pulling and stretching that highly compromised, fragile skin.
And the tragic part is, when she finally got her formal diagnosis, the medical professionals just handed her the label of a chronic autoimmune condition.
Right. Good luck, basically.
Yeah. They didn't offer any real practical lifestyle guidance. She was essentially left in a void.
And, nature abhors a vacuum, especially a medical one.
Exactly. When you hand a patient a terrifying diagnosis without a roadmap for daily living, anxiety just immediately takes the wheel.
So the logical conclusion she reached, and most people reach, is self-preservation through absolute stillness. She went to absolute extremes to protect herself. She completely stopped weightlifting.
Which was her main stress relief.
Yeah, gone.
Yeah.
She abandoned hot yoga. She even stopped taking her casual daily walks, just trying to become as sedentary as humanly possible.
And honestly, it makes total sense.
If you have a severely sprained ankle, you stay off it, you elevate it, you become sedentary so the torn ligaments can knit back together. Why wouldn't you apply that exact same logic to severe skin fissures on such a highly sensitive part of your body?
Right. But what's fascinating here is that the sprained ankle analogy highlights exactly why this intuitive response to lichen sclerosus is actually a trap.
A trap? How so?
Well, a sprained ankle is an acute mechanical injury. You rest it, the tissue repairs itself, and you resume your life. But lichen sclerosus is a chronic systemic inflammatory condition.
So it's not just a simple tear that needs rest.
No, the mechanism of the disease fundamentally alters the architecture of the skin. It actively thins out, it loses its natural elasticity, and, well, if the inflammation is left unchecked, the tissue can literally fuse together. It permanently erases the normal anatomy.
Wow. So resting on the couch doesn't just allow the skin to knit back together like a torn ligament.
It does the complete opposite. Becoming totally sedentary introduces severe secondary dangers. First, you're robbing the pelvic region of the vital blood flow required to deliver nutrients to that tissue.
Oh, that makes sense.
And second, maybe more importantly, you rob yourself of the stress relief that exercise provides. LS is closely tied to cortisol levels and your nervous system regulation.
So when you eliminate your stress relief mechanism, your baseline anxiety just spikes.
Exactly. And that chronic stress triggers a massive inflammatory cascade in the body, which then actively worsens the physical symptoms of the LS. You create a devastating negative feedback loop.
So if staying completely sedentary is a biological trap, we have to look at what's actually happening to the tissue when you do try to move. Like, why did that adductor machine cause Jacqueline so much agony?
It all comes down to friction.
Right. Looking at the clinical guidelines from the Women's Health Clinic, the primary enemy of LS skin boils down to a very specific combination: mechanical friction and trapped heat.
Those two elements are just the absolute perfect storm for exacerbating this disease.
The clinic specifically flags high friction, high heat activities, cycling, spinning, horseback riding, and long distance running.
Activities where you're constantly rubbing against something.
Yeah, and when you combine that repetitive mechanical rubbing with the buildup of sweat and, the tight compressive sportswear people usually wear, you get what the patient sources vividly describe as a relentless sandpaper sensation against the skin.
And that sandpaper sensation isn't just temporary discomfort or chafing. The friction is actually a biological trigger for a medical phenomenon known as the Koebner response.
The British Association of Dermatologists source dives into this heavily. What is the actual mechanism of the Koebner response?
So Heinrich Koebner was a 19th century dermatologist. He observed a very specific quirk in how certain skin diseases operate. The Koebner response essentially means that physical trauma or mechanical friction acts like a localized alarm bell for the immune system.
Okay, so the body senses damage and overreacts.
Right. In a healthy person, a micro tear from a bike seat signals the body to send healing factors. But in a patient with an autoimmune condition like LS, the immune system is miscalibrated.
So it gets the signal wrong.
Exactly. It receives that alarm bell and responds by sending a massive wave of inflammatory cytokines to the site of the friction. So instead of healing the micro tear, that inflammation aggressively worsens the existing disease or even summons a brand new patch of LS to that specific spot.
Wow. So the mechanical action of the workout is literally fueling the disease process at a cellular level.
Yes.
And that situation becomes exponentially more complicated when you layer on the context of menopause, which the Women's Health Clinic highlights. They point to genitourinary syndrome of menopause, or GSM.
A huge factor for many patients.
Yeah, because during perimenopause and postmenopause, a woman's estrogen levels plummet.
And estrogen is really the master regulator for the health of that specific tissue.
Right. The sources explain that the estrogen drop doesn't just thin the tissue, it causes this massive decline in lactobacilli.
Which are the protective, good bacteria in the vaginal biome.
Exactly. They're essentially the peacekeepers of the area. They feed on glycogen and produce lactic acid. And that lactic acid maintains a naturally acidic environment, usually a pH around like 3.8 to 4.5.
Very acidic.
Yeah, and that acidic mantle is the skin's literal chemical shield against friction and outside pathogens.
But when the estrogen drops and the lactobacilli die off, the environment becomes highly alkaline. The lipid barrier of the skin breaks down.
You're just stripping away the body's natural armor.
Exactly.
Wait, let me push back on this for a second, though. If the Koebner response means that mechanical friction literally summons the disease, and the acidic mantle is gone because of a drop in estrogen, leaving the skin defenseless, doesn't that mean an activity like a spin class is just permanently off the table for you? I mean, it sounds like you're biologically guaranteed to trigger a massive flare-up.
Well, it looks like a guaranteed flare-up on paper, but this is exactly where the conversation has to pivot from understanding the brutal mechanics to exploring the science of physical modification.
Okay, so there is hope.
Absolutely. You do not have to abandon your favorite activities. You just have to outsmart the friction.
So if cycling creates the ultimate Koebner trap, I was absolutely shocked to find this thread on the Mayo Clinic Connect forum. There's a 70-year-old cyclist who just casually drops into the conversation to say she's riding 7,000 miles a year.
That is incredible.
7,000 miles a year with active lichen sclerosus. That completely shatters the narrative that you are doomed to the couch.
It's a brilliant testament to understanding your own biomechanics.
Yeah.
What's her system for bypassing that biological alarm bell?
It's this intensely calculated series of modifications. She makes it clear that the solution is never to just tough it out.
Right, toughing it out is how you get scarring.
Exactly. Her first rule is getting a professional, customized bike fit. It's not just about slapping a softer seat on the bike, it's about how your pelvis interacts with the machinery.
The posture makes all the difference.
Yeah, you have to actively adjust your posture to tilt your hips forward. You want to anchor your weight entirely on your sitting bones, the ischial tuberosities.
Rather than resting any of your body weight directly on your crotch.
Right. And she says the hardware matters just as much as the posture. She warns everyone to avoid those wide, highly cushioned tractor-style seats you see on casual cruiser bikes.
Oh, because those actually displace the soft tissue and create more friction.
Exactly. Instead, you need a firm, pressure-mapped foam saddle with a cutout in the center to eliminate contact with the vulva entirely.
That anatomical shift changes the entire equation. You're actively moving the mechanical pressure away from the sensitive, LS-affected tissue and transferring it to the dense pelvic bones that were evolutionarily designed to bear the weight of your torso.
And she pairs that saddle with high-quality padded cycling shorts. But before she even puts the shorts on, she slathers the entire area in a thick chamois cream.
Creating a literal frictionless glide zone.
Exactly. And she adds a great caveat: if you try all of that and your anatomy just won't tolerate a standard upright bike, a recumbent bike is an incredible alternative that removes vertical pressure entirely.
If we connect this to the bigger picture, what that 70-year-old cyclist is demonstrating is a profound act of taking back control.
Yeah.
Whether it's a 7,000-mile ride
Right.
or someone simply trying to return to their local gym, the underlying principle is identical. You modify the movement so you can maintain the habit.
The sources apply that exact same logic to the gym and the yoga mat. Like, yoga is universally praised for stress relief, right?
Building pelvic floor awareness.
Yeah. But if you have an active tear or an angry fissure, certain poses are going to be disastrous. Poses that deeply stretch the perineum, like the happy baby pose, where you're on your back, pulling your knees to your armpits.
Or deep barbell squats in the weight room.
Exactly. Those are going to actively pull at that fragile skin.
So the modification there requires mindfulness. If the yoga instructor calls for a happy baby pose, you have to recognize your body's limits in that specific moment.
Right. You don't just follow blindly.
No, you swap it for a modified, gentle child's pose. You're still participating in the class, you're still doing the breath work, but you're protecting the compromised tissue.
But dodging specific yoga poses or swapping out a bike saddle is really only half the battle, because even if you eliminate direct pressure, you still sweat.
No, sweat is a massive factor.
Yeah, and the patient platforms are incredibly vocal that your wardrobe and your post-workout hygiene are your primary defense system against that Kobner response.
Clothing you choose dictates the microenvironment right next to your skin.
The consensus across all the patient guides is heavily focused on airflow. Breathable, seamless, 100% cotton or bamboo clothing is just non-negotiable.
Synthetic materials like polyester or nylon actively trap heat and moisture against the body.
And the Lichen Sclerosus guide offers a very pragmatic piece of advice. Sometimes the absolute best workout underwear is no underwear at all, provided you're wearing a pair of loose, breathable cotton track pants.
That makes a lot of sense. By removing the underwear entirely, you eliminate a layer of fabric that could bunch up and cause friction.
Yeah, and you remove an extra layer that traps sweat against the skin.
And the cardinal rule, repeated endlessly in all these sources, is that you cannot linger in sweaty gym clothes.
Never.
The moment the workout is over, you have to strip off the wet swimsuit or the damp yoga pants immediately.
Why is the timing so critical there?
That urgency is about halting a process called maceration. Maceration occurs when skin is exposed to moisture for prolonged periods.
Oh, like how your fingers prune up when you sit in a bath for too long.
Exactly. When the fragile skin of an LS patient becomes macerated from trapped sweat, it gets incredibly soft. It becomes exponentially weaker and much more likely to tear from even the slightest movement.
But there is a proactive step you can take before the sweat even starts, right? The clinical sources recommend applying a heavy barrier ointment right before the workout.
Yes, prep is key.
I think about this like greasing a baking pan before you put it in the oven. You wouldn't pour sticky batter directly onto dry metal.
Good analogy.
By applying a thick layer of Vaseline, a bland emollient, or even a hyaluronic acid product, you're greasing the skin. The clothing, the dough, in this analogy, simply glides over the greased surface instead of sticking to it and pulling.
That physical shield is essential. It repels the moisture of the sweat away from the skin. But, you bring up an important downstream problem here.
Getting it off.
Yes, if you're coating the skin in thick Vaseline and then sweating profusely, you have to get that mixture off your body afterward.
This is exactly what I was wondering. Because sweat contains salt and urea, if those sit on compromised, micro-torn skin, it's going to sting incredibly badly.
It's agonizing.
But the medical guidelines from the NHS are emphatic. You cannot use ordinary soaps, bubble baths, body washes, or feminine wipes.
The harsh surfactants and artificial fragrances in those products will strip whatever is left of the skin's acidic mantle. It causes a massive flare-up.
So how do you actually clean the sweat and the grease off without scrubbing?
The clinical recommendation is a strictly water-only approach, and specifically lukewarm water. Hot water strips the skin's natural oils.
Okay, lukewarm water.
But the most effective tool, which is heavily championed by the patient communities, is the peri bottle.
Oh, the little angled squirt bottles they give to women in the hospital after childbirth.
Precisely. You fill the peri bottle with warm water. While you're sitting on the toilet after a workout, you gently squirt the water over the area.
Oh, I see.
The mechanical action of the water stream dilutes any concentrated urine, and it safely flushes away the salt, the urea from the sweat, and the remnants of the barrier cream. No scrubbing required at all.
That's brilliant. And the drying process is just as critical, right?
Yes, you never take a towel and rub the skin dry.
Yeah.
You take a soft cotton cloth and simply pat the moisture away. And some patients swear by this. You use a hairdryer set on a cool, gentle setting.
The entire goal is just minimizing mechanical trauma at every single stage of the process.
Exactly.
But, I mean, we have to be realistic here. Even if you have the perfect greased barrier, the bamboo pants, the peri bottle, and the custom bike seat, lichen sclerosus is a stubborn, chronic disease.
It is. Flare-ups are going to happen regardless.
Right. So how do you handle the actual medical treatment of the condition while trying to maintain an active life?
That brings us to the core medical management strategy outlined by the NHS and the university hospitals. The precise use of ultra-potent topical corticosteroids.
The specific medication that appears universally in these medical documents is clobetasol propionate, often prescribed under the brand name Dermavate.
Clobetasol is the gold standard for halting the inflammatory cascade of LS. But because it's classified as an ultra-potent steroid, the exact mathematics of how you apply it dictate whether it heals you or harms you.
The dosage instructions are fascinating. The clinical guidelines state that you should only apply a pea-sized amount of the ointment for the entire affected area.
Just a tiny amount.
Yeah, they compare it to the amount of toothpaste you would squeeze onto a toothbrush. And they prescribe these steroid ointments in standard 30-gram tubes.
Right, and the crucial math here is that if you're using that precise pea-sized amount, even during an active flare-up phase where you're using it every day.
One 30-gram tube should last you 2 to 3 full months. So if you're calling the pharmacy for a refill of that tube in 3 weeks, you need to realize you are using way too much.
And using too much clobetasol is incredibly dangerous. Corticosteroids work by suppressing the immune system's inflammatory response. But in doing so, they also inhibit collagen production.
Oh, wow.
Yeah, if you overapply an ultra-potent steroid, you actively thin out the healthy skin. It becomes paper-thin, translucent, and just incredibly susceptible to tearing from the slightest friction.
But the clinical literature also warns that the reverse, like underusing the steroid, is just as destructive.
Yes. A lot of patients develop a phobia of the steroids, or they simply stop applying the ointment the moment the itching subsides.
Which makes sense. You feel better, so you stop taking the meds.
Right, but if you underuse the medication, you allow a low-level, invisible chronic inflammation to persist beneath the surface.
And what does that do?
That chronic inflammation signals the body's fibroblasts to lay down tough, inflexible scar tissue. That's exactly how you get those long-term, irreversible architectural changes where the delicate structures literally shrink and fuse together.
Finding the perfect, consistent maintenance dose is everything then.
It really is.
But here's where it gets really interesting, though, because we're talking about the daily reality of applying a highly potent, heavy, greasy ointment to your body and then trying to go about your day or head to the gym.
It's messy.
The Lichen Sclerosus Guide points out this highly practical but incredibly frustrating reality for patients. The steroid ointment completely ruins your clothes.
Oh, yes.
It leaves these stubborn, permanent grease stains on everything it touches. So you're trying to rebuild your confidence, you've invested in the expensive bamboo yoga pants, and now your primary medical treatment is permanently staining them.
It's a massive quality of life issue. The ruined clothing serves as a constant daily visual reminder of the disease right at the moment you're trying to overcome it and feel normal.
But the patient resources offer this brilliant, incredibly modern workaround for this exact problem.
What is it?
Absorbent period underwear.
Oh, that is a phenomenal hack.
Isn't it? After a patient applies their pea-sized amount of clobetasol, they just put on a pair of high-quality period pants.
Because these garments are specifically engineered with multiple layers to absorb moisture and completely block it from leaking through to the outside.
Exactly. They effectively quarantine the greasy steroid ointment, protecting the expensive workout gear or everyday clothing from stains.
It's such a pragmatic, elegant solution to a daily frustration that a sterile clinical textbook would completely overlook.
So, what does this all mean for you, navigating this diagnosis? The overwhelming consensus from the top-tier medical clinics down to the women sharing their hard-won wisdom online is this. A lichen sclerosus diagnosis is not a life sentence to the couch.
You absolutely do not have to surrender your active life.
You simply have to transition from exercising blindly to moving strategically. By understanding the biology of the Koebner response, you learn to respect your body's boundaries and modify your movements during a flare-up.
Exactly.
And by taking control of your gear, whether that means investing in a pressure-mapped bike seat, greasing the skin to block friction, or utilizing period pants to protect your clothes, you can safely reclaim the gym, the yoga studio, and the bike trails.
You know, this raises an important question, though.
Oh.
If we look at everything we've unpacked today about how trapped heat, compressed moisture, and synthetic friction are the absolute biological enemies of healthy, resilient skin,
Yeah.
take a critical look at the modern fitness industry's obsession with ultra-tight, highly compressive synthetic athleisure wear.
Oh, that's a good point.
We don't just wear it to the gym anymore. We wear it to the grocery store. We wear it on airplanes. We wear it everywhere.
It's practically a uniform now.
Right. And if this specific type of clothing is actively engineering the perfect storm of conditions for the skin's acidic mantle to collapse and for autoimmune conditions to thrive, we really have to wonder, is our cultural aesthetic of looking fit actually working completely against our biological need for our skin to breathe?
Are the very clothes we buy to broadcast health actually making our bodies sick? That is a fascinating paradox. And honestly, it's absolutely something for you to consider the next time you find yourself browsing the racks for new workout gear.
Definitely something to think about.
Well, until next time, keep asking the deep questions.